So I fine-tuned the title just a little bit because I'm not in an outpatient lab, I'm in a hospital-based lab. And so there is a difference on your motivation and the ways that you would save money, I believe, if you're an outpatient lab, but I don't have one. So we're going to talk about how to save money in a hospital-based lab. And these are my disclosures. So you would think, why is it important? Why is it important to say, you know what, I really want to do a good job and save the hospital money? Well, it is important because you want to build a reputation as a responsible steward of the hospital. This gives you leadership positions. This gives you ability to bring in new technologies. And a positive influence for the hospital brings you to a different stature for that hospital system. So when we think about cost, it's actually more than just cost, right? It's about total revenue. That's what the hospital cares about. They talk about total revenue, which is the revenue that you bring in for each case minus the cost of the procedure. So we have to think about both. So I'm going to kind of delve into both of those. Now, how would you start doing this? If you say, yeah, you come away from this talk and say, yeah, you know what, this is probably important for me and for my hospital, how do you do it? Well, the way I started is the first thing I did is I went to our cath lab manager and I said, I want to see the cost of my procedures and I want to see how much I brought in for all of those procedures for the past quarter. So I did that when I first came to this hospital, and I track it even now. And the reason that's important, because we learned a lot of things actually, because I was one of the first in one of the smaller hospitals to start doing a lot of these procedures, and they didn't know how to bill correctly. So for the first 6 months, they were losing money for atherectomy procedures because they were billing them as angioplasty procedures, and they weren't aware of that. So we had to go back to our billing department. They made those changes, and so that's important. And for you personally, that might be important because you might not be billing correctly. You might not be dictating correctly. So in order to, first we'll talk about maximizing your reimbursement. So in order to maximize reimbursement, there are several components to this. First of all, you have to make sure you dictate the patient complexity and the procedural complexity. Understand how different treatment modalities are reimbursed. Know which vascular beds are reimbursed as separate vessels, and if appropriate, use the same device for multiple vessels. So let's talk about patient complexity. This is really important. Make sure this is in your H&P, make sure this is in your discharge summary, make sure it's in your note. Patients that have congestive heart failure, coronary disease with previous revascularization, chronic kidney disease, hypertension, all of these things add to the complexity of your patient, which subsequently means that the hospital gets reimbursed at a higher level. Now, procedural complexity is also important. Multi-level disease is billed at a higher level. The complexity of procedure is billed at a higher level, and usually what I'll do is you can have an extra code added, and I dictate at the end of my procedure, this procedure took approximately 50% more time than a traditional procedure of this type. And then your coders can pick up on that, and there's extra coding that they can give you for that. So when we think about understanding how to bill correctly, this goes through the different stages and the different levels of what you can bill for: iliac, femoral, tibial. So really understanding the vessel treatment groups. So what can you bill separately? The common iliac artery, external iliac artery, and internal iliac artery are billed as one unit. So if you treat all three of those vessels, it's only going to be counted as one vessel. The profunda femoral artery, common femoral artery, and superficial femoral artery, as well as popliteal artery, are all billed as one vessel. The tibioperineal trunk, peroneal artery, and posterior tibial artery are billed as one vessel. And the anterior tibial artery is billed as a separate vessel. So if you understand that, then you can kind of understand how to make sure that you're billing this correctly and that your coders pick up on this. But at the end of the day, when we think about newer technologies that have a higher success rate, sometimes they may be able to save you some time. They may be more efficient, but they're more expensive. So you have to balance that with the traditional technologies or less expensive technologies, which may be a greater learning curve, but have a lower cost. So we talk about how to increase your revenue. So how do you decrease costs? Well, first of all, you got to know the cost of the equipment. So there's several equipment. For example, we were looking at one of the devices in our hospital the other day, and a similar device was $800, and another comparable device was $350. I didn't know that till about 2 weeks ago. It was just a microcatheter. So if I hadn't known that, I wouldn't know that, I'd choose one over another. So find out what different devices cost on the shelf. I perform an inventory of the cath lab equipment routinely, and I replace more costly products that are equivocal with less expensive options, especially commodity products such as microcatheters, wires that are equivalent, or sheaths. So as you can imagine, there's a variety of different costs for different devices. Usually you think about the fact that wires and catheters are probably the cheapest. Balloons are, about the same level. Crossing devices, stents, DCBs, DESs, and so forth become more and more inexpensive. So if you think about each step in your procedure, if we dissect each part of your procedure, how can you cut costs in each part of that? Vessel access, you might be able to cut some costs in the type of sheath you use, because there's a wide variety of cost with a certain sheath, and if you feel like it's equivocal, that might be an opportunity. In terms of lesion crossing, again, maybe you may be able to fine-tune your wire and catheter that you use, or you may consider different crossing devices, but again, that goes to that balance of efficacy and time saving. In terms of treatment options, you may not have much of a choice. Angioplasty balloons are about the same price, DCBs are about the same price, atherectomy devices and stents are pretty much the same price, so there's really not much opportunity there. In terms of vessel exit, manual compression obviously doesn't cost anything except for the fact that you're increasing your length of stay. Patient is laying in the convenience. I always use closure devices. I think it's worth the money. So if you do all of that and you dissect all of this stuff, why is the hospital still losing money? Again, look for correct documentation. Is there something going on that you're not documenting correctly? Maybe you're not doing the procedures right. Maybe you're doing a CTO, it takes you 10 wires and 5 catheters and all these other things. So learn newer technologies, learn pedal approach, learn new ways of doing things that make you more efficient. And there are new devices that are always on the market that, again, make you more efficient, that will probably allow you to maybe cut costs on wires and catheters and other things that you may be using, that you're using a lot of. Maybe you could replace it with one of those crossing devices. But most importantly, don't give in to temptation, especially if you have an outpatient lab. Do not try to save money by unnecessarily staging procedures. Do not withhold technology with a clear benefit due to cost. And do not treat a patient based on their insurance status. So in conclusion, I think it's important to help your hospital save money. It's not only important for your career, but also for the longevity of the hospital. Remember, total revenue is not just cost, but the revenue of the procedure as well. Understand how to maximize your billing and coding, your reimbursement, cut costs by choosing less expensive commodity products. Understand that there's a balance between cost and efficacy. Look at the global picture. You may lose money in certain really complex cases, but in general, you'll look at the bigger picture and it'll still bring you patients if you're having successful cases. And at the end of the day, do what's right for the patient, and you'll always win. Thank you.